My name is Clement Erabo. I'm a diagnostic radiographer, Somerset NHS Foundation Trust, Taunton. I'm originally from Nigeria. I trained as a radiographer in Nigeria. I worked for 4 years before moving to the UK in 2018. Training as a student back then in Nigeria, I've always wanted to practice radiography outside the shores of Nigeria. So I looked at so many countries, but I discovered that the UK shares so much similarity in terms of level of practice and syllabus with what we've got in Nigeria. So that was the first thing. Everyone was really welcoming, but it was a very challenging first few months here because of the weather, the culture and everything. It's a bit different to what I was used to. I think new members of staff here in Taunton are treated they're very welcoming. The manager, even your colleagues are welcoming. So because working in a new environment, even though I've been qualified for 4 years, can be really challenging, but they make sure that I was quite comfortable. Anything I didn't understand, they tried to explain. I was assigned a mentor, and he was really, really good. I think the same thing, the level have not changed ever since the past 6 years. Every new member of staff is made to go through that 3 to 6 months preceptorship program, depending on your level of experience. I've always, right from I was a kid, I've always wanted to work in the hospital, but I didn't know what I want to do, whether to be a doctor or a nurse. But I wanted to help people, to help the sick people. Why I choose radiography is I understand that radiography is just like the eye of medicine. So every patient that comes to the hospital, at least, will have 1 or 2 things to do with the imaging department throughout their stay in the hospital. So I wanted to be part of that thing, that I worked with high-tech equipment to look at inside of the human body with the aim of finding out what is wrong with for the patient. So I love my job. I love what I do. I love the fact that I can use my knowledge of anatomy and physiology, and also my knowledge of the use of the equipment and how to operate this high-tech equipment to diagnose patient problems. So it's what I look forward to. It can be busy, challenging. I still love what I do because it's what I've always wanted to do. I like coming to work because sometimes I know I'm going to meet my colleagues, have a chat with them, see a patient. Sometimes some patients can be really anxious, not knowing what to expect. You try to calm them, talk to them, reassure them. At the end of the whole procedure, they will come out smiling and thanking. That alone makes me feel happy and feel fulfilled. There's no regrets at all. I don't have any regret moving in the Southwest or even coming to the UK. Over the years, for the past 6 years, I've learned quite a lot as a radiographer coming here. I love being here. That's why I've not even considered moving to somewhere else ever since I came here. I love my colleagues, my other Nigerian colleagues and other colleagues as well. I love working with them. There's no regrets at all. I'm quite happy and I hope to continue. I will encourage radiographers, especially newly qualified, to consider moving to the Southwest or moving to Taunton because they are very supportive here. You also have the chance career progression. You can progress quite quickly. You can go from doing a plain film to CT to MRI to ultrasound. Whatever you want to do, the opportunity always there. You also have managers who are very understanding and also try to treat everybody according to your needs. We as a human or as a radiographer, there's always this one thing that you love doing. Find it and never stop loving and keep doing it, because therein your success lies.